It's estimated that the amount Americans are exposed to radiation has increased significantly over the past 20 years. Some experts believe due to the increased use of medical imaging like CT scans. But here in the Valley, one center is working hard to reduce the risks while helping patients ask the doctors the questions they need to know.
We use radiation to create medical images.
And it's that amount of radiation, as small as it may be, that has many patients concerned when they undergo a test such as a CT scan.
Anytime you're exposed to radiation, there is potential that the DNA is damaged in a cell. And so over a lifetime, someone's risk may be 50% in a lifetime that they develop some cancer. So any additional insult to the DNA, and our bodies have a way of dealing with that. Our cells can repair the DNA so that those risks are averted.
Dr. Jared Allen is a radiologist at Scottsdale Medical Imaging, or eSMIL. He says the centers are consistently working to reduce a patient's potential exposure.
Typically, the strategy is to reduce your overall exposure to radiation over your lifetime so as to reduce the cumulative risk of any adverse event such as cancer.
And eSMIL's strategy to reduce the accumulative risk starts with each individual patient. Before the patient even arrives, this highly experienced and trained staff determines if a CT scan is the best tool to diagnose, or is there another appropriate exam, such as an ultrasound or MRI, that doesn't use radiation. They also look at the patient's weight and age to determine the appropriate dose. Then, using their state-of-the-art technology, they're able to deliver the lowest dose of radiation possible.
When you come to eSMIL, we use state-of-the-art equipment that has built-in safety and consideration for dose. A lot of the innovation of CT scanners in particular over the last several years and really decades is focused on reducing dose while still providing good diagnostic images.
After each test, the CT dose is then entered into a system-wide database for comparison.
What this allows us to do is compare ourselves to our region and to the nation in terms of how safe are we? Are there areas where we can improve? And so that near real-time dose monitoring, CT dose monitoring, it really helps us to identify areas to continually improve.
So what questions should you be asking your doctor?
Is there an alternative exam that could answer the question that my doctor and I have? Is there a safer way to do it? And I think patients should really feel empowered. They should seek to get informed, either by talking to the doctor or talking to our staff or our radiologist at eSMIL.
And it's eSMIL's goal to continually improve the patient's experience and safety. And it's this commitment that Dr. Allen says helps set eSMIL apart from other medical imaging centers.
We understand what the doctors need from us in terms of diagnosing disease and providing the imaging that they need to help manage their patients. But they also know that our patients have a good, safe experience, and they can be reassured that they're getting the safest care in the Valley.
If you want to find out more information about Scottsdale Medical Imaging and all of their Valley locations, visit their website, eSMIL.com, or call the number you see on your screen.
It's a simple